about 45 seconds to a minute at the most to do all of those tests.
That's it.
You got it. Let's see. Who doesn't have a bad set of knees? Okay, Lisa, come on up, please.
Who doesn't have? I don't have a bad set.
Yeah, I want somebody who has good knees, who doesn't have a bad set of knees. Okay, go ahead and lay down. All right, I'm going to go through each test individually, and then I'll go through the whole process. All right, first test is the patellar glide test. All the patellar glide test is check for patellar motility. Have the patient relax. Relax. There you go. Good. And what you want to do is you want to move the patella side to side, back and forth. Check them both out. They should be freely movable and move about equidistance. The next test is the patellar compression test. The patellar compression test is basically a test to see if the patient has chondromalacia patella. Although you cannot diagnose that without arthroscopy, we can at least try to get a feel for it. So what I'm going to do is have the patient relax their quads. I'm going to place the upper pole, the superior pole of the patella in the crook of my hand, and then I'm going to ask the patient to tighten up these muscles right here. And when she does that, the patella will be forced underneath my hand and will scrape against the femoral condyles. If they have chondromalacia, that will be uncomfortable. If they don't have chondromalacia, won't bother them a bit. So that's patellar compression. The next test is valgus and varus stress. Taking the patient's foot, tuck it underneath your elbow. What you want to do is you want to apply valgus stress while pulling in with your elbow. So basically what I'm attempting to do is keep this part of the leg straight, and then I'm taking this part of the leg and turning it like this. So I want to apply, the patient has to be relaxed, I want to apply stress on the knee, pushing the knee in this direction, or valgus stress, and pulling slightly on the foot. Alright? This is a test for medial collateral ligament. Then I take my hand, bring it over the top, and now I'm going to apply varus stress, and I'm going to take my hip and I'm going to push in this direction while I'm pulling out on the knee in this direction. Okay? So valgus stress, varus stress. And the knee should be slightly flexed to about 10 degrees. You don't want it fully extended. Once I'm done with that, I'm going to move up and I'm going to do Lachman's. Lachman's test. Stabilize the femur, and I'm going, and with the knee slightly flexed, I am going to attempt to lift or distract the tibia away from the knee. So this is stable, this is lifting. Okay? This is the test most people have the hardest time with. From here I'm going to do McMurray. All I'm going to do is take my hand, move it down, palpate the joint margins. Take my other hand, slide it down to the ankle. I'm going to bring the knee up to flexion. I'm going to externally rotate the tibia and extend the knee. I'm going to bring it back up. I'm going to internally rotate the tibia and extend the knee. That's McMurray's. The next thing is drawers. I'm going to bring the foot up, stabilize the foot, and I'm going to apply positive force for the anterior drawer and negative force for the posterior drawer. This is basically a test for anterior cruciate ligament instability, posterior cruciate ligament instability. So anterior and posterior drawer. The next thing I'm going to do is on the next page, it's called the pivot shift test. The pivot shift basically combines varus and valgus stress with McMurray's. In essence, what you're going to do is you're going to bring the patient's knee back up to flexion. You're going to externally rotate, and while I provide valgus force on the knee, I'm going to extend it. What I'm feeling for is at about the point of full extension, I'm going to feel a little shift or a little pop in the knee, which may indicate ACL instability or may indicate some problem with the meniscus. Bring it back up, internally rotate, and apply varus stress and extend the knee. Now, there's also anterior instability where you can do it from the extended position and do it up into flexion. Do the same thing here and do it up into flexion, from extension to flexion. So I was taught to do it in this direction, so that's what you're going to see me do.
One more time.
Okay? Bring the knee up, externally rotate, and apply valgus stress to the knee. So I'm putting all the force against the lateral meniscus. Then I come up here, and by putting the force here, I'm basically spreading the joint out here and compressing the joint in here. So by putting varus stress and internally rotating it, I'm putting all the pressure against the medial meniscus. So that as I bring this down into extension, if there's a tear or if there's any problems with that, I'm going to get a shift or a little pop in that knee just about the time I get to full extension. And that's what I'm feeling for. All right, last but not least, roll over on your stomach, please. And we're going to do Apley's test. And with Apley's is a grind test. So I'm going to rotate internally and press down. I'm going to rotate externally and press down. And this is a test for a meniscal injury. Okay? Okay, roll back over for me, please, Lisa. The whole test shouldn't take you more than 60 seconds. Patellar glide, patellar compression test. Tighten up those muscles for me. Okay, good. And we're going to push a little bit and out a little bit. And I'm going to do Lachman's. I'm going to do McMurray's. To do the drawers. I'm going to do pivot shift. Is my time up yet? And roll over.
35. Total.
10. And roll back up. What did I forget?
Verbalize all the stuff you said.
Yeah, there you go. But fortunately for me, I don't have to do that. 35, 45 seconds to do a good knee examination. It's all about the flow.